Before we get started, a brief reminder that any and all opinions and views shared by hosts and guests on this podcast are the speaker's own and do not represent the views of Primal Kitchen or its affiliates or parent company. Fat transfer. How long is recovery on a surgery like that?
Part of the process is making sure you identify the things pre-op and then take time to adjust them. I think many people take so much time in the decision-making process to have surgery that then they want to get it done. Like they have to just get it done. I just want to make sure that Morgan has the best possible, shortest recovery that she can, because that'll make you the happiest. Then afterwards, spend enough time with us so that we get you off to the right track with hyperbaric oxygen therapy or lymphatic massage therapy. And really, lymphatic massage helps get your body to detox you more quickly. So the fluid or the swelling you experience, it can be dissipated much more quickly through lymphatic massage.
Hello, everyone. I'm Morgan, co-founder of Primal Kitchen and host of the Primal Kitchen podcast. Today, I'm excited to welcome Dr. Robert Whitfield, a board-certified plastic surgeon who specializes in breast implant removal and helping women restore their health after breast implant illness. He is also sought after for his holistic accelerated recovery program, which focuses on reducing inflammation while patients are prepping for surgery or recovering from procedures. In this episode, Robert will be sharing his expert knowledge of breast implant illness, symptoms to look out for, and the pros and cons of undergoing any implant surgery. Before we get started, a brief reminder that any and all opinions and views shared by hosts and guests on this podcast are the speaker's own and do not represent the view of Primal Kitchen or its affiliates or parent company. Hello, how are you? Welcome to the podcast.
I'm great. Thanks for having me on. I use your products and have for some time.
Oh my God, I love it. It's amazing. So I'm super excited to chat about this. I feel like 5 years ago, every influencer on Instagram was building a house, and now every influencer on Instagram is getting their breast implants removed. This is like the hottest trending health thing that not a lot of people are talking about, but it's everywhere. I have multiple friends who have done the surgery recently, and you are like the go-to guy. So how did you get here? What do we need to know about breast implants? And give us the lowdown.
Well, sure. So I'm in Austin, Texas, and I got here after basically 13 years of training and a stint in academics. So after about 19 years, I came to Austin and just went into a group practice. And after about 5 years, I started a solo practice. But towards the end of the group practice, a breast cancer patient came to me for a consultation regarding going flat. And so over the course of that 19 years of work, I had from, many, many years of breast cancer reconstruction, had patients occasionally want to go flat. It's more of a trend now that is a requested,
Yeah.
outcome.
But were you also putting implants in? Is that right for those previous 19
Yeah,
years?
so mostly what I did was reconstructive microsurgery. So for cancer,
Okay.
I would make someone a jaw. I would do breast reconstruction using your own tissue from the tummy. And I had a particular niche in doing sarcoma reconstruction. So I really worked all over the body doing cancer
Okay.
reconstruction.
Got it.
And so from time to time, we would do implant-based reconstruction, and to a far lesser degree, based on my schedule, cosmetic augmentations. So mostly I would get patients who had failed breast reconstructions with implants that then I would remove and do what
And
I
clean
did
up.
in terms of a reconstruction called a DIEP free flap. So I had a patient with implant-based reconstruction who did not want any more reconstructive surgery. She just wanted all the implant material removed. And so when you do that in my, training and practice, I did a particular way where I took all the scar tissue out anyway. And then we would test everything to make sure there's no recurrent cancer, no infection. And basically, this lady had an undiagnosed E. coli infection. And so that was really weird to me. I went back through all the notes. I couldn't figure out how I missed it. And it was there clearly. And so she had just had fatigue for these several years, and nobody could figure out what was wrong. And so I was just like, oh man, if this is really a big part of this. And fast forward, she put me on a Facebook group, and I just had people start coming to me out of the woodwork and
Crazy.
wanting explants. And my office is like, why do they keep calling here wanting an explant? And I'm like, I don't know. And basically, I presume she put me on this
Got it.
message group on Facebook. And then from there, the rest is history. The the thing that I was concerned about, and when I started seeing patients, they would come to me and they had a lot of complaints that I think, and I'll for your audience, I'll say it's confusing for providers who are taking care of patients when they have lots of different complaints all over the body because it doesn't
Right.
make a lot of sense. The doctors and we're trained to recognize patterns and then come up with a treatment plan based on what we think the potential problem is. And so one of the very first times a patient came to me and said they had brain fog, I was like, okay, Morgan, tell me what brain fog is to you
Right.
because I don't know that concept. Like, explain to it. And basically, you would say, "Hey, Rob, it's Dr. Rob. It's I forget where my keys are sometimes, or I can't remember my kids' names, or I left the groceries in the car." All things we've probably done, but it's happening all the time at a very, very early age, and it gets blamed on all sorts of things. Women who've had
Stress, when you're just
kids
stressed.
or
Yeah.
stress or fatigue or um, like the
You're
postpartum
crazy.
thing is
You made it
happens a
up. You're
lot.
hormonal.
Yeah.
Yeah.
And
Yeah.
so, and to me, that's just short-term memory loss. So I characterize it in something that I understood, as short-term memory loss. And in a young person, that's very concerning. That shouldn't happen. So I just have remained curious about the symptoms and the complaints that women would come to me with, and they're like, I mean, it's a laundry list. It affects every system of the body, and I think fast forward over 7 years, I can tell you how I feel breast implant illness should be looked at. It should be looked at as chronic inflammation. The breast implant is simply one component of a continuum of chronic inflammation. How you get there is a very, very interesting journey. It starts with your parents. You can't pick your parents and you can't outrun a bad diet. So if your parents gave you basically poor enzymatic detox function, well, you have that. Now, if you have a bad diet, you maybe live in a moldy place, get exposed to a bunch of different things where you work or live. Um, you can see how what I'm going to say makes a lot of sense. If you build up a certain amount of toxicity and you have only so much ability to detox it based on your genetics, then you're going to get symptomatic. I think we can all agree that makes sense. And I have a bunch of patients who have mold exposures, environmental toxin exposures, heavy metal exposures. They have difficulty with gluten, like I do. I can't have gluten. I'm not celiac, but I don't do well with gluten. They may have
Yeah.
a bunch of foods that trigger them. They may have parasitic overgrowth in their gut or candida overgrowth in their gut or H. pylori or whatever. I mean, there's just a litany of
Yeah.
problems. So I think, the world is not getting to be an easier place to live in. All the time it's getting harder. So it's no wonder that people have more trouble. And these kind of chronic inflammatory symptoms are not just breast implant associated. You can have a hip implant, a knee implant, a dental implant, cardiac implant. I mean, nobody's immune to that.
Hmm.
And that's how I think
So,
of it.
yeah. And so in this E. coli case, like, is the implant itself, like, in carrying the E. coli, then, like, you remove the implant and the E. coli infection goes away?
Right. So it's a great question. So like they're like everybody wants to know how that got there. Right. So did it happen at the time of insertion? Like if I'm the surgeon, did I put it in there with the implant? Somehow was it contaminated or somehow did the staff give me something that had, the material on there and then I put it inside. So those are two out of the three ways you can have that happen. The third is by hematogenous spread. And so for the audience, like anytime you have a cold, anytime you have a urinary tract infection, anytime you have basically they call it translocation, but when your bacteria leak from your gut into your bloodstream, then you can contaminate any device because the device, so it has no blood supply. It's just a device. It's not alive. So whether it's a hip implant, knee implant, a heart valve implant, all that stuff can get infected. So it's no wonder that people get biofilms, which is what I'm talking about, on devices. And these have been around for a long period of time. Biofilms were created by bacteria that don't want to be killed by your immune system. So they secrete this goo, if you will. It's like a sugary goo So your immune system can't get rid of them. And the bacterium that's most commonly found on implants and the breast implant that I see is Cutibacterium acnes, which is on our chest, face, neck, and shoulders.
Interesting. Okay. So you're saying these breast implants can be like a component of this overall inflammation that certain people may be more or less susceptible to based on their own genetics. What percent of people with breast implants do you think are suffering and maybe don't know, or I don't know, like how pervasive do you think the problem is? Like, do people notice a discernible difference in their health when the implants are removed? And like, do you think it's a situation where almost like nobody should be putting in breast implants?
So I can give you the genetic profile that has the most trouble.
Yeah, like
That's
MTHFR mutation, I'm
Yeah, if
guessing.
you have poor ability to metabolize vitamin D, poor ability to methylate, which is part of the MTHFR, uh, it's one of the 5 genes. If you have an
Mhm.
inability or limited ability to handle environmental toxins, heavy metals, chemicals you may get exposed to, that's your in your liver, your how you manage your glutathione. And then the final one's your antioxidant pathway, which is things like vitamin C. So if you have trouble with your antioxidant pathways, those are the 4 main ways that I see people have difficulty with detox.
Interesting.
So if you have 3 of those that are low functioning, or if you have all 4 that function low, then you're a setup to have problems with inflammation.
Yeah.
And the more inflammation you're faced with, the more complicated it is for you to deal with it. And so you add in a bad diet or difficulty based on where you live or where you work, you may get exposed to chemicals. So I've had people who are exposed to smoke because of the way their work environment is, or people who get exposed to parabens or phthalates or glyphosates. These are all things we get exposed to through plastics or food or products. And so if you just don't have the ability to detox well, your skin it gets exposed to that and you absorb a lot of it and you don't clear it very well. So then over time it builds up and it meets, you have a threshold like everybody does. And once you get past that threshold, you become more and more symptomatic. And like you mentioned stress earlier, I mean, goodness gracious, everything's more stressful these days. So it's surprising like all of us don't have adrenal fatigue in some way, shape, or form. I feel like I do on a daily basis. So
Yeah.
women in general are responsible many times. They're working, they're taking care of kids, they're managing households. I mean, that's that's a pretty complicated equation. And if you throw in a device, difficult with diet, a lot of my patients have gut problems. So their absorption is really impaired. So even if they were getting the right foods, they may not get their nutrients in that are needed. And so then that makes it complicated. That's why I've converted almost all of my pre-op supplementation that I can to liposomal, which means for the everybody in the audience listening, it's a liquid. So a lot of people have
Mhm.
trouble swallowing pills or they get pill fatigue. And I would just want everybody to do the best possible with the program that we have. So a lot of it's liquid based. So it's easy to do a mouth spray for your
Yeah.
B vitamins that are methylated, vitamin D3K2, which is the most easily, absorbable form of vitamin D that's activated. And then, we have our glutathione that's the same. It's a mouth spray. And of course, I got to have a liquid vitamin C because that's a great antioxidant.
Yeah. And that's part of your holistic accelerated recovery program?
Yeah, that's the supplementation. And we just
Got
based
it.
all of our package is based on supporting those genetic pathways that you need to level up as much as possible. So if somebody has 3 of those 4 that don't work well and they have one that works well, you want to make that one that works well work even better while the others are
Yeah.
getting leveled up as much as you can. Now, if all 4 don't work well, you got to support all 4 and get your gut working better. So all of our program is not to react to a situation, but it's to be proactive to get you in the best possible position to lower inflammation. That's how you get the best
Yeah.
recovery process.
Yeah. And what percent of your practice is breast implant removal?
From the surgical side, it's basically 100%.
100%.
Yeah.
I mean, are you just seeing such an increase in people who are wanting their implants out? Like,
To
are you just
me,
booked
it
out
will
for the next
become the
few years?
most performed plastic surgery procedure probably over the next 5 years.
Interesting.
Because now there's a lot
That's
more awareness. There's a lot
Yeah.
less confusion about it. Hopefully, we've contributed to provide clarity to that through my show, the Breast Implant Illness Expert, and then being on other shows like yours to share, our experience. I've done, like I said, it's about 1,600 explants over like 7 years and well over 3,000 consults for it. So I see 40 or 50 people a week.
Yeah. Crazy. What else is part of it's like do you guys call it the HARP program, this accelerated recovery program? Is there stuff you do post surgery that's like unique?
Right. So we talked a little bit about supplementation, but all of that's based on preoperative testing. And, when I was trained,
Yeah, I was gonna ask that. Do you do genetic testing before you do all of your surgeries?
right, it's funny how
Okay.
I was trained, and I had excellent teachers. But back when I'm old now, I'm 54. So when I was trained, like you looked at a complete blood count, your electrolytes, a echocardiogram, or I'm sorry, an EKG of your heart, and basically a chest X-ray. And they're like, "You're good to go, Morgan. You can have surgery. Everything's fine."
Right.
But if you're in your 30s, I mean, if all that's not fine, you got a problem. And
Yeah.
the things we do now are more based on functional genomics. So I want to know how your detox works, how you should be eating, and that's a saliva test. It really gives about 100-page report. We use the DNA company out of Toronto. It's been great in terms of formulating what we use for inflammation lowering support. Um, then we look at a total tox test, and that's a urine test. And you want to see, like, has there been a big mold exposure? So it looks at all the various mycotoxins from molds,
Interesting.
in particular, something like ochre toxin from black mold. And then, of course, it's looking at heavy metals. I discussed on the Skinny Confidential podcast, like how many heavy metals can be in someone's tox test. And then when you're looking at um, think of like environmental exposure. It gets a little in the weeds here because not everybody's very familiar with some of the things I'm going to talk about. Glyphosates is a desiccant and herbicide that's used on crops all the time.
Yeah.
So when you get a tox report that has glyphosate, like my first tox report had glyphosate in it. I grew up not eating great foods. And now, my wife's great. She makes sure like we have all organic stuff and it's all grass fed, no hormones. Well, I grew up as a kid that really wasn't a thing.
Yeah.
So that's one way to get glyphosates. Phthalates are plastics in plastics. So like a water bottle, they make the bottle firmer and that stuff gets into the water and you drink it and you absorb it. And that's how you get phthalate exposures. It's also in receipt paper, the thermal paper on
Yeah.
receipts. So it's a very common way to get phthalate exposures. And then a lot of things that you probably would know from products are as we want, and I tell all of our patients, like, do not get anything that doesn't say paraben free. Like, you can't have parabens in your products. They're easily absorbed through the skin. And so you'll get a bunch of different exposures of those three out of like a litany of exposures that you can have. So you take that and couple it to, we do a food sensitivity test that looks at 250 foods and a gut microbiome test. We just are trying to figure out what triggers you and then how many things are imbalanced in your gut. You add all that to some blood work to look at your hormones because your sex hormones are important, and all the things I mentioned in terms of your gut and any kind of environmental exposures from parabens and phthalates, they all are endocrine disruptors, and women are particularly sensitive to that. So your hormones can be, on a whole, I think I see just a ton of hormone imbalance, thyroid hormone imbalance, estrogen, progesterone, testosterone. In particular, I get a lot of people with really suppressed libido. So think of that. Like if your vitamin D metabolism is poor, if your methylation pathways don't work well, if your inability to, handle antioxidants, like all the things that would be normal for sexual health, and you have suppressed testosterone, like it's a wonder why people have poor libidos who have breast implant illness. Like all of it is just really complicated when you put it all together and look at it. So we get all that testing done through it's all functional, like saliva, blood, urine, stool. We get all that. Takes several weeks to months to get all of it back. We put you on the inflammation lowering support bundle, and then if the tox test comes back poor, we're going to put you through phase one detox, and we have a partnership with Cellcore. So we use their products, and I have a practitioner who just focuses on that in my practice. Because of the way it's working, we take a time period of 4 to 6 months to get people prepped, usually for surgery before we do their explant. We have a series of medications we use the night before just to calm down the nervous system, decrease nausea, decrease inflammation. And then in the operating room, once I do an explant, we're taking everything out as undisturbed as possible because there are a certain number of breast implant associated cancers, as well as like my patient had infection. So I don't really want any of those things getting into the
Right.
pocket.
Got it.
And then we have a medication that's widely used called Exparel, and we numb all the areas up as much as possible so that when you're waking up, you don't really feel anything sharp or stinging. Lasts about a week. And I
Okay.
don't use drains. We've worked out how not to use drains, um,
Oh, that's
especially
nice.
when I do fat transfers. We just connect the pocket with the spaces where I've done some of the fat removal, so it just drains internally. And then the next day, folks come to my office. I have a hyperbaric chamber in my office, and we have a lymphatic masseuse and lymphatic massage device. So we're trying to get all of that done while most people are here about a week, and then it's just about proper diet, supplementation. You know, I like people to walk and recover and not overstress themselves. So the more we have you here, the better. Some people try to keep changing their plane tickets so they can't leave, which is totally fine
Yeah.
with us.
Sounds great. Sign me up. This is like mommy camp or something.
Right. Yeah. So we're gonna build a nice retreat for everybody. I just gotta get that done. And then
Sounds
people
fun.
head home. We see them at it's usually a month, virtually in 3 months, 6 months, 9 months, 12 months. And if I can get you at 3 or 6 months to come back in person based on logistics, that's good for me, especially if I've done a fat transfer. The
Got it.
detox can resume remotely based on your previous testing. So it's a lot going on in a year, basically.
Yeah, that's crazy. And are you doing any of that like functional medicine testing and treatment with people who don't have implants? Like if you were going to do a fat transfer, which I want to talk about next, but if you were going to do that, would you put them through the same program?
I would.
Yeah. What about people who just don't have anything? They don't need anything with their boobs and they just want to like feel better. I mean, all this program you're doing sounds great. Like, do I need to have a boob issue to do all that or no?
So right now we take care of our clients because I don't
Okay.
have I have over 9,000 active clients. So the
Yeah. Crazy.
it would be ideal to
Too much.
expand it, but currently we don't offer it outside of our patients and their caregivers.
Got it. Okay. Talk to me about fat transfer.
Sure, fat's the original filler. It's been around for over 100 years, and I'll explain it this way: everybody wants like volume, and if you're just looking for a cup size, it's very easy to do a fat transfer. But normally, people who want breast augmentation don't have enough tissue, and that's obviously why they're looking for breast augmentation. So I think it's more about weighing risks and benefits and understanding who is potentially a setup for problems. So I do a lot of holistic transformations with fat. So I'll take fat from inner outer thighs, abdomen, love handle area, and I'll transfer that to the breast. I don't do BBLs anymore, which is the same transfer to the butt. I
Oh,
focus
got
on
it.
the
Okay.
breast, and we do a bunch of those awake in the office. But if you're a low BMI patient and you need all those areas treated, or if you just want to max out the removal process at one time, then we do those in the operating room under general. And we're running the same type of program. Fat works extremely well. You just want to make sure you understand someone's genetic profile, their toxicity, make sure they're on the proper diet for themselves, not eating foods that are going to trigger them or upset them. I don't operate on people that get bloated and swollen or are constipated. So I want to
Mm.
make sure those things are taken care of because I'm not going to make those better. I'm going to make them worse
Yeah.
with surgery. So
Yeah. Interesting.
everybody can
All right.
have it. It's just got to get through a process.
So you would say fat transfer is good for like if you're trying to go up a cup size or maybe if you've like nursed 3 babies or like stuff like that. Like
Oh,
who's the
for
good
sure.
candidate?
Yeah. I've
Yeah.
done a lot of transfers, and ideally I call it the holistic mommy makeover where you're just taking all that fat, and instead of using an implant, you just use your own fat with or without a lift.
Yeah.
So it's not that everybody can do it. Obviously, there's patient selection factors. So I try to see obviously who's the best candidate for that and have a nice detailed conversation about it. And if it fits well with their expectations, then that's a good procedure for them. And also, fat transfer results can be addressed and augmented in another setting. So it's a it can be added to. It's not one of those things where it's just like one and done.
Oh, got it. You might do it in addition to getting your explants out.
Yeah.
I
And
see.
if you're just doing
Interesting.
it on its own, you can go back and get more fat added later. Typically, as we age, we gain fat, we don't lose it.
Yeah. So question for you. Why are you not doing the Brazilian butt lifts anymore?
Because I have too many explants to do.
Got it. Okay. So you're staying focused. I like it. And then you mentioned fat's the original filler. Are people using fat like instead of filler in their face or anywhere else, or is it just being
You
used in
can, but
like,
the thing you should always worry about, Morgan, in your face is everything will heal. So you have to be very judicious and conservative with how much you're using. Because once again, you're going to age and typically gain weight over time. You're not going to lose it.
yeah.
So if you look at results over time with fat and it's been put in a face, the people will get heavier looking.
Oh, interesting. Because it kind of like the fat
Yeah, it'll
grows.
hypertrophy. Yeah.
Okay. Is it true that when you do like liposuction and whatnot, like they always say like the fat grows back elsewhere? Is this true?
Yeah, I don't, I get asked that a lot. I guess for me, the easiest analogy I will say is when you take fat out of one place, if it doesn't look like fat was taken out of there, then that means over time that person ate themselves out of a result. But typically, it's the thing that I said before, like you're gaining weight over time. So if you had some areas treated and others not, those areas can gain weight. Does that make sense? They look disproportionate.
Got it. But what if you just take the fat out and you don't put it anywhere else? Like, it doesn't just, you know what
I
I
think
mean?
as a
Like,
contouring rule I try to follow is like say when I do this, I'll explain how I do it. I borrow from the
okay.
inner thigh, the outer thigh, the love handle area, and the abdomen. And then we usually add skin tightening to anybody like 30 plus who's had kids because our skin doesn't get tighter over time, it gets looser.
Yeah. What's skin tightening?
So I use Body Tight, which is a bipolar radio frequency device. It goes through the same little spot that I use to take the fat out. I do it at the same
Okay.
time. It helps shrink down and tighten the skin over where you remove the fat.
Interesting. Okay. I have had 3 C-sections. So I have like this just very, and I don't have like a high BMI. I don't know. You can really see me here, but like I don't have like, but I do have like a little, I didn't have it as much after my first, but I'm noticing like after 3, like the skin is just stretched out where my incision
Right.
was and it drives me nuts. Like, what am I supposed to do about this?
So
Drives me
Body Tight
insane.
can help that. You can
Okay.
also, if it's indented, you can do a little bit of fat grafting. Those are the things where I've found minimally invasive ways to treat it so that it's not yet making another big opening that you have to heal.
Yeah, it's not like, is that a tummy tuck's like a full on, they cut it.
Yeah,
Like
and
that's
I
a
don't really do
different.
those anymore. One, because the downtime is really not conducive to everybody's lifestyle now. And
Yeah.
I've had a few recently where people just kind of have gone off and done their own thing and had problems because of it. So I try to at all adhere to the principle like if I can get it done in a minimally invasive way and get a change that they're comfortable with, then that's the way to proceed. And then I let others who just want to go and get the whole shebang done, they can go do that.
Yeah.
I've got a lot of other things that I got to get done for
Yeah,
people.
totally. Totally. Interesting. God, it's so fascinating. So tell me about your own personal, like, it seems like you're pretty dialed in, or like, what supplements are you taking aside from maybe the, like, if you're on the liposomal ones you mentioned before, but like, what are you doing that's maybe a little bit more out there that folks at home wouldn't have maybe heard of?
Wow, if you could see my desk, that would tell you everything.
I'm a supplement junkie too, man. Like, I have a problem.
Yeah. I go to a lot of
Yeah.
meetings of health entrepreneurs and biohackers. So
Yeah.
basically, when I come back, there's usually a little Amazon truck waiting for me at the office with the supplements
Yeah.
I got.
You're on timeline. Are you taking pendulum, probiotics? What are you doing?
Yeah, I don't do probiotics. I like fast a lot. I do like to do that. I like all things that are liposomal. So I take all my
Okay.
own liposomals. And I certainly like a lot of detox things. And I also like astaxanthin, uh, fisetin. I always take a lot of resveratrol, reishi. Um, I like liposomal NAD. I will dabble in a lot of things. I'm just looking around my desk. Some
So funny you mentioned astaxanthin. I like lived in South America for a few years and I was surfing like quite a bit. And I had read that astaxanthin was this is like 12 years ago and I want 15 years ago. God, maybe even like 20 years ago now. I wanted to launch it like a healthy sunscreen, but I was taking Badger sunscreen and it was like so white and zinky. This was like, non-nanoparticle zinc
right.
oxide, right? And I was squeezing my astaxanthin, putting a pin in them and squeezing the pink into my Badger white sunscreen and creating my own because astaxanthin has some like skin protection
Yeah.
for SPF doing it. Yeah, but big
Yeah.
anti-ox.
There's all sorts of really great. I probably do too many sometimes, if that's possible,
Yeah. What
because
about diet? What are you doing diet wise?
oh gosh.
Like, what does a day in the life look like?
Yeah, I'm trying to do basically a Mediterranean diet. I like a lot of fruits. I do a lot of protein. Like if I would be a
Yeah.
pescatarian if there was good enough fish in Texas all the time to be pescatarian.
Yeah.
That's my favorite thing. So if I'm on the coast visiting somewhere, that's all I'll have.
Yeah.
Because in
That's
Texas you'll
great.
get a bunch of meat, which our meat's really pretty good quality. There's lots of great ranches around here, but I miss the trappings of being on the coast somewhere, either in our country or Europe, because that's my favorite thing to sit and order whatever's daily and fresh caught.
Yeah. This is like a random other question, but what's your take on like Botox and regular filler?
So I think I concentrate on some of the fillers that look more natural. So I like the RHA product by Revance because it stretches when you smile or make any
Okay.
kind of facial expression. So I do like that. I'm pretty conservative with filler. I don't really like filler that looks overdone. I don't like super big
Yeah.
puffy lips or cheeks or things that obviously don't look natural. So I'm pretty conservative there. I think all of the different types of neurotoxins that really reduce the amount of human serum albumin you get exposed to. So daxibotulinum toxin, zeamin, there are ones that have a lot less of human serum albumin, and that is nice. Botox still really works well if you just want to relax lines. I do have products that actually take skin out and don't leave a scar. So probably everybody's heard of microneedling with Morpheus 8.
Yeah.
I was the first
Yeah.
person in Austin to have that in
Oh,
2018.
crazy.
And now I have some devices that take skin out and don't leave a scar. So
Mhm.
hollowed out microneedles will take skin out under suction. And the device we have is called Elicor. We combine it with some other tech I have, face tight, soft wave, and then do a neck lift. And that's my no cut facelift. So I don't use a knife and still get
Right.
facelifting simulation. And then I have stem cell extraction in my office using your own fat. So because I use a lot of fat in general, we can take the fat out, process it in office, and give it back to you in the form of your own stem cells, either IV or atomized. If we're doing a no cut facelift, we can add stem cells to it, or if you want a facial with it. Um, the the kind of best and holy grail, if you will, is using your own stem cells because it has your own genetic material. Um, so it's not a non-autologous like exosomes, which we have as well. So we have each of those options to give more enhanced wound healing. And I think knowing someone's genetics and offering them to be able to use their own stem cells, modify their diet, get them on the right supplements. I mean, you'll see people change pretty dramatically. The easiest person to take care of is somebody who doesn't know any of this. Like if they show up and
Yeah.
you take out of their diet gluten and dairy and sugars that are bad for them and just processed stuff in general. And then I do, traditionally I would do their explant and they just have like an epiphany. They feel totally
Yeah.
different because all their
I
inflammation
bet.
drops. Now I get
Yeah.
more complicated cases where everybody's seeing a naturopath, integrative functional practitioner. They're on supplements. They may not be on the ones that I would pick for them. They've done some testing. They may have done some detox, but now it's more of a they're aware that something's wrong. They don't know exactly how to treat it. And the We're trying to work with different practitioners to help them get educated about this. We have a practitioner training program, so we'll help train
Oh,
practices and then we'll help train surgeons.
cool. And so you're doing like Morpheus 8 and you're doing some face stuff as well in your office.
Yeah, so the two main things when we're at the surgery center, I'm taking out devices, taking out
Yeah.
implants, doing fat transfers or lifts or explants alone. And then in my office, I do all these other things under local. So we have Soft Wave, we have Morpheus 8, we have Elicor, which takes the skin out without leaving a scar. We have Face Tight and Body Tight. We'll do lipo and fat transfers in the office under local, and we do hair restoration under local. And we combine all these things with and without your own stem cells because we have that in the office.
So cool. Are you worried about like Botox or filler for just like the same, I don't know, general toxicity, like the similar issues to breast implants, or do you feel like they're safer than having an external device in your body?
Yeah, I haven't had the reactions. Now, if I have somebody who's a poor detoxer, um, I tell them to be much more judicious, especially with filler,
Yeah.
because I have seen people have a response to that, like if they're incredibly sensitive or have lots of inflammation. But once we're taking care of that, just being conservative with it, I think is fine. I haven't had problems.
Interesting. Okay. Well, that's good to know. Great. This was so wonderful to talk to you. My last question I ask everyone this, but what's something most people don't know about you?
Oh my gosh, something that they don't know me about me. Oh, I guess everybody probably knows at this point, but I'm a big Ted Lasso fan. I get a kick out of that show. Um, I'm a big soccer fan. Austin FC is here, and we go to Europe whenever we
Cool.
can to see, football matches. My favorite artist is Batiste. Most people don't know that. What else? I just a great day for me is being able to hang out with my wife and relax, which we don't get to do very often.
Yeah, I love it. Thank you. That was like four great things. Well, I so appreciate you spending the time with us. I feel like I learned more than I ever thought I would need to know about breast implant illness and all the things. So I super appreciate it. Will you let everyone know where they can find you
Sure.
so they can follow along or learn more if they want to?
Sure. We have a whole podcast that I devote just to breast implant illness. So it's the breast implant illness expert with Dr. Whitfield. And that's on Apple and Spotify. And then we have a URL that's breastimplantillnessexpert.com. And then you can follow us on Instagram at breastimplantillnessexpert. If you want to learn more about cosmetic treatments, it's at Dr. Robert Whitfield on Instagram. And then we have a URL at drrobertwhitfield.com that focuses on many of those cosmetic treatments we talked about.
Cool. Okay, I have one last question that came in my mind. I'm going to be sad if I didn't ask you. The fat transfer. How long is recovery on a surgery like that?
So I'm writing a book about surgical recovery, and the whole point
Yeah,
of it is to decrease the time it takes to recover. So part of the process is basically what we talked about, making sure you
the pre.
identify the things
Yeah,
pre-op and then take time to address them. I think many people take so much time and build up in the decision-making process to have surgery that then they want to get it done. Like they have to just get it done as quickly as possible because it took them this much time to come to that conclusion. Where um, I just want to make sure that Morgan has the best possible, most efficient, shortest recovery that she can, because that'll make you the happiest. That'll make me the
yeah,
happiest when I see you because you'll be doing well quicker. So the people that do the
yeah.
best quicker are the ones that run through our program. And then we follow our process, obviously, that we discussed about in the operating room. And then afterwards, spend enough time with us so that we get you off to the right track with hyperbaric oxygen therapy or lymphatic massage therapy. And really, lymphatic massage helps get your body to detox you more quickly. So the fluid or the swelling you experience it can be dissipated much more quickly through lymphatic massage. And we really find that hyperbaric oxygen therapy helps clear people up after surgery more quickly. Even in some instances, people certainly tell me outright that it helps to reduce their pain from where they had fat removal. So all those things help you recover quickly. I usually can get people, in and out of garments faster because of that, sometimes in half the time. So people are up, especially if it's an awake fat transfer. The one I did this morning, a lady got up and left, and there's no downtime. So
Crazy.
it's more a function of like, you know, once the swelling occurs, how efficiently do we get the fluid out? So she's coming here tomorrow to the office to have lymphatic massage with our German device that we use. And she'll do that a few times a week and then do a hyperbaric treatment. She'll maintain, her supplementation and dietary changes that we make pre-op, and she'll recover more quickly. And I don't know that like the downtime people normally associate with a procedure is really how I think about it anymore. If I'm doing more than a few
Yeah.
areas, then we'll probably do that in operating room and we'll run the same process. And then it's more about how you clear anesthesia. I have a great anesthesia team that I've used since really 2018. They know my program. They don't over medicate my patients. So my patients all wake up relatively quickly and can go in then 30 or 40 minutes normally. So it's not a
Crazy.
big, I don't have that worry in my head as a provider.
Yeah.
So my patients don't experience that problem after surgery. They're not having problems with nausea and vomiting and kind of the typical things, or being too groggy,
Yeah.
or so the things that you normally equate with, you know, downtime, recovery periods. We work hard on the front end and in the operating rooms, and then certainly in my office afterwards to avoid that.
Okay, so it doesn't sound like you're not like out of commission, bedridden for 3 weeks after you do like a fat transfer. You're like,
No.
No,
You're gonna come to my
no.
office the day after regardless. So
Yeah,
you have to
got
be with it to do that. So I
it. Okay.
have people come
Um,
the next day against my wishes driving themselves. So
yeah.
I mean, if that should that's all you need to tell somebody.
Yeah, no, that's crazy because that's quite different than getting implants. Like, I remember when my mom got her implants, she was, like, out of commission for months. I mean,
Yeah.
it was a while, like
No,
yeah,
it's nothing like that. I mean, it's more,
okay.
you know, anytime you do a fat transfer, you take fat from one place, so that causes inflammation at the site, and
Yeah,
then you transfer it to the space beneath the skin. So it's important. Let's talk about that for a minute. Like we do not put fat in the breast. That just makes cysts and problems on your mammograms. You put
oh, interesting.
fat beneath the skin because that's where the fatty layer is in everybody, everywhere, all over the body. So that's where the
Yeah.
fat belongs.
Oh, interesting. Arms, what can you do for arms? Like, if you wanted to lose fat in arms, like, what would you
So
suggest?
we combine like fat removal and skin
Mhm.
tightening, and that will give you a more sculpted arm appearance.
Is there any, like, side effects of skin tightening?
For us, you could potentially get like a thickening effect, but I haven't had any where I felt like we've had to do anything. And you can always combine it, like I said, with microneedling, or you can take skin out with my
Yeah.
device Elocore. So there's lots of ways that are minimally invasive now that really didn't exist even 2 years ago.
Oh, crazy. Crazy. Okay. Well, thank you for the extra bonus 10 minutes of the podcast. I'm fascinated. I appreciate your time. It was so wonderful to meet you and keep up the good work.
Thank you for having me on.
Yeah, absolutely.